Hello, everyone, and very happy to welcome you for our new Luma Live Series about another look at the COVID-19 epidemic in Thailand with Dr. Gerard. So the first part will be about why early treatment of COVID-19 is the key. So please, we are welcome Dr. Gerard. So hello, doctor, how are you?
Thank you. I'm fine. What about you, Alex? You are okay?
I'm good. Thank you very much. Thank you very much.
Great. So this is the first part of a series of 3, right?
Yes, correct.
Oh, okay. All right. Good.
Yeah. So we will start the Facebook Live talking about, could you please explain us what is the early treatment and what we can avoid any problems with this?
Okay, that's a very good question. Before I go to the details of early treatment, especially for COVID, I'd like to review some basic knowledge about how a virus infects our body. So it's a kind of very simple course on virology or immunology. Very simple to understand. So what people have to understand is a virus is a parasite. Parasite means it must enter a cell and live inside the cell. And this is a very important advantage for the virus, because when they enter the cells, they hide from the rest of the cells of the host. And they will multiply inside the cells without going out. When they go out, it means the cell explode and release thousands of viruses which have been multiplying inside the cells. Okay. So the advantage of being inside the cells is very important, because the immune cells, and Alex, what are the main immune cells which are involved in the defense of the body?
Is the white blood cell, I guess.
Congratulations, that's good. So the white blood cells cannot see the viruses because the viruses are inside the cell. So when they are, let's say, inside the cells, they start to multiply. We call it replicate, and it goes very fast. So let's take an example. Somebody receives from a friend a viral load. The friend is coughing, and 1,000 viruses enter through the nose of the friend. So you have a viral load of 1,000 viruses which enter the body, and let's assume that these 1,000 viruses will infect 1,000 cells. So inside these 1,000 infected cells, they will multiply, replicate. White blood cell cannot see anything because they're inside. And after 24 hours, 48 hours, then there will be 1,000 viruses in each of these infected cells, which means 1,000 times 1,000 is already 1 million viruses. So the cells will explode, and 1 million viruses will go quickly hiding into 1 million infected cells now, which each will produce 1,000 viruses, which means after 24 hours, 48 hours, it's 1,000 times 1 million, which means 1 billion viruses, just after a few days. And if you continue like this, let's say 24 hours or 48 hours later, these 1 billion infected cells, like these 1 billion viruses, will make 1 trillion, 1,000 billion viruses. Okay. So it goes very fast. And the immune system has not really time to react. When they start to react, because of course they will see some viruses going out, it will be already 72 hours or more, and there will be a huge number of viruses to contain. It should be very difficult. Okay. So the second thing to understand why early treatment is important is how antiviral works. This medicine works by blocking the viruses from entering the cell before they can infect. So they block the viruses. The viruses cannot enter the cells in that case. That's the example of ivermectin. It works like this. And other antiviral works by inhibiting the process of replication inside the cells, by blocking the multiplication of the viruses inside the cells when the cells is infected. Okay. So I think even a child of 8 years old can understand. if you have a medicine, which is, let's say, an antiviral, you give 10 milligram or 15 milligram of this medicine. If this 10 milligram of medicine has to block 1 million viruses, it's okay, can do it. But if it's 1 trillion viruses, this 10 milligram cannot work, will not be enough. And you cannot multiply by 1,000 the quantity of medicine because you will have so many side effects. Medicine, you can maybe double the dose, but you cannot multiply by 1,000. So early treatment works on these two, for these two main rationale. First, the viruses replicate very fast, and you have to start treatment very early because at that time, when the quantity of medicine is still enough to control and contain the small, relatively small number of viruses. After, unfortunately, it doesn't work. As simple as this.
Okay, thank you very much. I would like to ask you some questions about the updates on Thai CDC recommendation. Could you please help us about the updates, please?
Yeah, so this update dated August 4 is a good news. It's rather a good news because first they introduced now the home isolation program, which means they allow people to be treated at home. Before, everyone with a positive PCR test has to be hospitalized. The logic behind that was, for the Thai government, they don't want to leave someone who is potentially infected, infect other people within the same family. And often the Thai family lives in relatively small places, so it's difficult to have the infected person being isolated in one room. They will still share the lunch, dinner, and so on. So the logic was, okay, I get this patient, potentially somebody who can infect others, and I move to the hospital so that I'm sure that I properly isolate the person. That was the logic. But this is not a medically sound logic because you go to hospital when there is an indication to hospitalize. When, to make it in simple terms, you hospitalize someone with an acute respiratory infection when he may need intravenous antibiotics or intravenous antiviral agents, or more importantly, he may need access to oxygen. If you don't need to have access to oxygen or give a treatment through intravenous route, can be just tablet, for instance, form, you can treat at home. And influenza, flu are 99% treated at home in every country of the world. Okay? So they introduced a home isolation program with specific guidelines, which is a program for 14 days, which the hospital has already well organized the process, and I will go back a bit later on that. And this will definitely improve the situation of the hospital, which I think is one of your questions you wanted to ask later on. Okay. The second thing is, and that is also very good news, they, as you know, the Thai government classified the people who are infected with COVID in 4 groups. Okay. The first group is asymptomatic, people who have no symptoms, and often no risk factors to develop a severe COVID. Okay. This is group 1. Group 2 are those who have minor symptoms because it's early symptoms, and they have no risk also to develop a severe form. These group 1 and 2 are considered green. Green cases can benefit from the home isolation program. The next 2 cases are yellow and red. To make it simple, are people who can develop severe complications of COVID or they have already advanced symptoms. So yellow and red, hospital. Green can benefit from home isolation program, but home isolation program is not only stay at home nowadays.
Yeah, it will be my next questions. What is the home isolation program? Because we have many questions around here. Many people asking like what it is clearly. Could you please explain us, please?
Yeah, the last point I would like to just to finish with the previous question is, in the home isolation program, they also introduced the validity, or they consider relatively valid, the rapid antigen test. But I will mention this a little bit later because they still require a PCR, which is a gold standard to confirm the diagnosis of COVID. They still require a PCR test. Okay. So what is the home isolation program now? It is a program organized by hospital, which lasts usually 14 days, and is usually given as a package. People first must be diagnosed by usually the hospital in what we call acute respiratory infectious clinic, where people can go just walking. You don't need to take appointment. If you want to do PCR for traveling, you need to send an email and take an appointment. But if you have symptoms, you can go straight to the hospital and you go to the what they call ARI clinic, acute respiratory infection clinic. Then the nurse will welcome you, and then we do a PCR test. And on top of that, you have a consultation with the doctor. Okay? So they will assess you. They will put you in a different group. And if you are green, which would be most of the case, if people come early, then you will have to wait for the result of the PCR test. And depending on the result, if it's positive with minor symptoms and you have no risk to develop complications, then you start the home isolation program. If the test is negative, then you may be treated for something else, maybe just a cold infection, or I don't know, maybe a dengue fever, who knows. And if the symptoms worsen, you will be encouraged to repeat a PCR test, let's say 2 days later. Now, when you are in a home isolation program, you enter a 14-day program during which every single day there will be a medical professional to call you. What they do, every day you have a nurse, usually a trained nurse about this acute infection, who will call you every day, checking your symptoms, whether the symptoms are just improving or stable or sometimes worsening. And every 3 days, you have a call with the doctor. Of course, if the symptom worsen, the call of the doctor is advanced. If everything is okay, you will complete the program and then you can start again your activities. If the symptom worsen, then you may need to come to the hospital to do some tests. They can do some blood tests or imaging tests, for instance, chest X-ray or CT scan of the chest. And of course, if the tests are still suggestive that the infection has progressed, then they will suggest hospitalization. So you'll be in hospital to benefit from possibly oxygen. What is important for the home isolation care is there is really management of care. Because not only a nurse will call you or a doctor, but you will receive at home, without going to the hospital, the medicine which you would have normally received at the hospital. So they will send you antiviral medication. And nowadays, with this revision, the antiviral used by the Thai government is a favipiravir, which is oral medication with many tablets to take every day for at least 5 days, sometimes extended to 10 days. But what is important in the revision of the 4th of August is favipiravir is prescribed as soon as possible. It's not so much left to the decision of the doctor, although the doctor still decides. I mean, the doctor should always decide about what is good for the patient and what is not good. But they strongly suggest to start immediately, as soon as possible, favipiravir. And that is rather good news.
Okay, thank you for your answer. Just have another question about this home isolation. Should we go to pick up the food downstairs, for example, if we order, or do we have to talk with our condominium or people who are taking care of the
program? That is a bit confusing for me because there is sometimes a confusion between home isolation program and hospital. Because what the hospital are doing now is they develop the home isolation program, and for that they need some support from what we call telemedicine support. Not all hospitals have telemedicine. Now they are very quickly adopting this service, especially during this time. Okay, but they have also the hospital. So they converted hotel in some kind of care facility for those who just need to be isolated. because there is not really oxygen there. It's not an hospital by far. And they have the hospitalization, of course. So now, depending on the case, they could orient the person to home isolation, which is in that case, you stay at home, you are supposed to cook for yourself, right?
Yeah.
So you
yes,
need
yes,
to
I do.
get food from outside. Now, if you are in a hospital, you cannot cook by yourself. So the 3 meals are provided. So I'm not too sure about what I understood from some international hospital, like 𝐏𝐴 Hospital in 𝐏𝐴. The home isolation program let the person to cook by themselves. So they don't provide 3 meals, from what I understood. Okay, in a hospital is different because you cannot cook by yourself. Okay.
Yeah.
But the management of care is still the same. You have daily call by nurse, and you can receive your treatment whether in home isolation program or in hospital. Okay.
Okay, thank you very much for this answer. I have another one regarding the hospital situation nowadays, because we can read, we can watch TV, and we have some news around, but we have not a clear view. Could you please explain it to us? What is the current situation of hospital here in Thailand?
Okay. As you remember, somewhere in May, early May, last May, there was a chaotic situation in India. Remember the CNN and BBC showing people outside the hospital looking for oxygen. There was no more oxygen in the country of 1.4 billion people. It was really a kind of chaotic situation. By the way, it resolved very quickly later on. The Indians have been doing very, very good job, and especially in providing early treatment also. So now in Thailand, as I mentioned earlier, the logic was to hospitalize anyone who was a PCR positive. And a lot of these people actually do not need to be hospitalized. They need just to be managed, medically speaking, but they can be treated at home or in hospital environment, not in hospital. So when the government, the CDC, introduced the home isolation program, a lot of hospitals moved patients which were already in hospital occupying a bed back to home isolation program. They also increase their capacity for hospital, so they can pull out turnover of patients quickly out of hospital back to hospital, and in a way make more beds for hospitalization. So the situation was tense. There was kind of almost saturation somewhere in late June, early July, and a lot of people starting to send some alarmist type of feedback all over the place. And I even heard that in some expatriate communities, they were considering to repatriate their expatriates. Those who are not in critical position were sent back home. Or the families of these expatriates did not return to Thailand, stay in their home country in Europe, for instance, okay? Because there were some, not rumors, it was true that there was a very tense situation. There was a waiting list in some hospital. Even some well-known hospitals could not get back patients, their own patients, who were affected with COVID because of the saturation, simply because they saturated by themselves the beds in a not a logic approach. So once they reverse this by the new protocol, home isolation program plus hospital, then it releases a lot of beds. And I believe, because I'm often in touch with the managers at different international hospitals, I'm not too sure about the situation in government hospitals, but at least for the expatriates, I think most of the hospitals now can offer a bed relatively quickly within 24 to 48 hours. So the situation has been improving dramatically because of this new strategy, which is hospitalizing people only when they really need to be hospitalized. The rest are managed in a proper setting at home or in hospital.
Okay, great. So we can see that Thailand improved a lot regarding the situation, and also give some different program for different kind of cases.
Exactly.
My next question.
I hope, Alex, that also head office of major companies in Europe in particular, will try to find out. I suggest that they do also their own research and not only trust whatever we can say here, but look at the situation here. Of course, it's not brilliant. Since the month of April, we have been facing a kind of real epidemics because we did not have almost anything in 2020. But if you see the trends now, the peak was attained somewhere on the 13th of August, but this is a number of cases and we don't know exactly what does it mean because the screening is more a political decision than really a medical decision. So if they stop testing, they will have less cases, of course. So we don't know, but it seems anyway that the trend seems to be improving now. So I hope also that these companies which have invested for years and years in Thailand will consider keeping their operations at full steam here, because I hope also that one day we'll hopefully see some kind of recovery of this world.
We are waiting for back to normal, I will say. So let's see when is it. And my quick last questions. Could you please give us some advice also about the early treatment? And in this question, I add one more. When should we call the doctor if we have some early feelings? What we should do?
Okay. Again, that's a very interesting question. I think it's good for closing the Facebook Live. You remember, Alex, I told you that early treatment, there is a clear-cut rationale because the viruses, they hide into the cells and they multiply very, very fast. So if you can give the medicine, which works, but it works at certain dosage, if you give it when there is still a few millions viruses, you can control. When it is billion or trillion, it doesn't work. It's a race. It's a race of initiating the treatment versus the multiplication of viruses. Okay. So in practice now, from what I'm saying here, the ball game is not in the hands of the doctor. The ball game, let's say, to survive or to have minimal complications of COVID lies into the hands of the people. The people have to realize that there is a race, so they have to go quickly to the hospital, to this kind of RE clinic, for instance, get the test, and then be treated. Because I believe, like many clinicians believe in early treatment, it works. It helps to avoid many hospitalizations, including people young like you in good health. If you can be treated early, you can avoid having more severe symptoms, and sometimes you may go to hospital. Maybe you are not going to go to ICU, but you are still occupying a bed for someone for some time, which is not good. Okay. So in practice, how to behave? Let's say on day one, the person start to feel get some very early symptoms like sneezing, feeling of being warm, maybe to have some running nose, kind of uneasy feeling, nothing very strong yet, but something a bit strange, not usual. So here should be already warning signal. Day two, already 48 hours. Okay. Then the symptoms may disappear, that's fine, it was just something minor. The symptoms worsen a bit, meaning to say you start coughing, the feeling of being warm is now a real fever, you can measure it, it's over 37.5, which is 37.6, 7, 38, this is fever already, and then the feeling of being tired more than usual. So definitely you must make the diagnosis within this first 48 hours. Why is it so important?
Okay.
Because now you rush to the hospital. You can do the antigen test, which is very interesting, and I will explain a bit later on that. If the antigen test is positive, you are contaminated with COVID, 98% chance to be contaminated with COVID. But the hospital will not trust, and they do trust, but they will still need to confirm with PCR. So you still need to go to some place like RE clinic, the one in Sami Tibet is very well organized. You get the consultation with the doctor and the PCR, and then you still need to wait 24 hours to get the result of PCR. It's one more day. So remember, first day symptoms, second day you feel that too many symptoms, it's time to go. Then you go and you still have to wait one more day to get the result of the PCR, 72 hours. What I would like today is people to remember 72 hours. You should be able to have the diagnosis as early as possible, and 72 hours is what people should think when it comes to COVID, because then they can receive the treatment, favipiravir, and hopefully in the future a second antiviral agent, because one is usually not enough, but for the time being, the Thai CDC put only one, which is strange, because in March, April 2020, they used to consider 2 antiviral at once. Now, only one, favipiravir. I hope they will add a second one like ivermectin in the future, okay? But if it starts at 72 hours, then you have a high chance of not developing more severe symptoms, okay? On top of favipiravir, they also suggest to take zinc. They suggest also to take vitamin D, vitamin C, which is also important to take. These nutraceuticals are also important in the prevention of COVID. And for those who are asymptomatic now, they suggest also the, I cannot remember the name, the fatalajone, the medicine, the Thai herbs, which seems to have some efficacy, and why not to use it? But you cannot use in combination with favipiravir. So this is purely for asymptomatic fatalajone. For symptomatic people without risk of developing severe COVID, they must be diagnosed in how many hours? How many
72.
hours? 72 hours. We have to put 72 hours so that they can really prevent the more severe manifestations of COVID. All right?
Okay. So this is the main important information is to be an adult and to feel. If you have some feelings, if you have some symptom, you have 72 hours, as you said, to be adult. I would say, like, we have to be this way, right?
Is, often people, and that we see that also in other disease, which is also very severe. For instance, in heart attack, for getting the best treatment of heart attack is this kind of interventional cardiology, which reopen the artery of the heart, which is blocked by a blood clot. Okay, if you can do that within 3.5 hours, you reverse totally the negative effect of the serious pain you had, and you are not actually getting a real heart attack because you can save all the cells which are affected. If it goes beyond these 3.5 hours, you will have some, unfortunately, irreversible lesions of the heart, which can later on lead to heart failure. Okay, so people who have heart problems have been, I hope, are informed about the need of recognizing the early symptoms of chest pain and so on, and go straight to the hospital, not to think, oh, I'm getting a chest pain somewhere at 11 o'clock in the evening, I will go tomorrow morning at 6 or 7. It's too late. That's a mistake to make, not a mistake not to make. Okay, the same applies here. For instance, you have some symptoms, first day, you neglect it. You don't consider, no, it cannot be. Second day, certain symptom. Not enough. I seem to need to get a third or fourth day. And then you have 4 or 5 days already symptoms, and you start to have some complications of your lung before you start the treatment. Again, because of the very, very fast multiplication of the virus in the body. So you have to go immediately. 72 hours is a take-home message today. You need to recognize the symptoms as soon as the first day, to make sure the second day you go straight to RA clinic. You can even go to the first day to RA clinic if you feel that you have symptoms and you have been in contact with someone who used to be affected by COVID or with PCR positive. So the first day of symptoms, you go. You don't need to wait 2 days. Okay, as soon as possible, you go to this RA clinic, do the PCR test, and you start the treatment.
Okay, so we
Okay.
will note it. I hope everyone noted 72 hours. This is the most important, latest, yes. So this one was the first part of our Luma Live Series. So first of all, I would like to thank Dr. Gerard Lalande for all the advice and tips you gave us. We will have part 2 next week about the long COVID. So don't say anything right now, Gerard. We will see it next week. It's pretty interesting and pretty important thing to know what is the long COVID, what can happen, and all these kind of things. So yeah, thank you very much, Dr. Lalande. And
thank you, Alex. Thank you for organizing this.
Thank you very much to all the viewers. Do not hesitate to leave your message, leave your comments. We will reply after our Facebook Live. And you are welcome to join us next week for the part 2 about the long COVID cases. Thank you very much, and have a great day. Bye-bye.
Bye-bye.